I am Dr. Shankar Reddy, and I studied from Tirupati Medical College. From there, I went to Armed Forces and I finished my surgical oncology there. And from there, I came back to my district, that is Kadapa, and back to Hyderabad. Over a period of time, I realized most of the diseases in India, or most of the Asia and Africa, are terminally cancer patients. I am sure some of you in this crowd, their families might be suffering with a similar problem. So, you agree or don't agree, most of the families will suffer with this problem in future. So, how to face a problem? Do you all believe that there used to be a cholera? You all believe that or not? Right? Now it is, you barely see it and barely people die with it. Now the God has found out tuberculosis. We won over it, right? Then he started making another deadly virus, that is a HIV virus. We have overcome out of it, right? We barely see death due to HIV nowadays. Now he found out and he has given a challenge of a cancer for us. Now it is our duty to face, to get a good treatment and to win over it. Understood? So all this can happen with only one issue. What is that? Awareness, acceptance, and finding out the disease in very early stage. Our forefathers has won over the cholera. Our fathers has won over a tuberculosis and AIDS. Now it is our turn to face, to overcome the cancers, so that our future generation will have a beautiful life. We all work for the same cause. Okay? So keeping that in mind, we'll start with a basic awareness. There is nothing to be ignored about it, and there is nothing to be afraid of the cancer, because the cancer is changing now from worst to better stage, but the incidence of cancer is going from the worst to much worse stage. You agree with me? We don't know about a cancer 2 decades earlier. Now, because in those days, like during 80s and 70s, people keep dying it. They don't know the reason. If you start discussing with your family members, they keep saying, what is the reason of a death of our grandfathers and grandmothers? We don't know. That could be a malignancy. That means it could be a cancer at all, right? Initially, I thought, because in the cancer there are 4 stages, to brief with you all. Stage 1, stage 2, stage 3, stage 4. In brief, stage 1 means it starts from where it has origin. No body organ is immune for the cancer. And some people can claim that my family is super family, we don't get a disease, we don't get a cancer. It is a misnomer. Nobody is immune from not having a cancer. So we should all know, agree, accept, and keep moving on for our this immediate family and the future families also. So cancer has a 4 stages: stage 1, stage 2, stage 3, stage 4. Stage 1 is from where it has started. Stage 2, it goes to the next level of the system. Stage 3 goes to the in between. Stage 4 is the one that has already spread to the rest of the body, where you don't get a cure. Most of the Asian and especially Indian subcontinent, we all get patients with stage 4, if not stage 3. Anybody who got stage 3, so take it for granted, 50% of the mortality. Mortality means it is a death rate. 50% is a very huge one. So our main motto, my main motto is to keep people aware of the disease. You know, it can't be preventable. It can only diagnose in a very early stage, so that you can get a good cure rate. Stage 1 has 98-99% of the cure. Stage 2 has around 80-85% depending upon the cancers. Stage 3 slaps down to 50%. Stage 4, so it will be 2 to 10% max. So this is, I am talking about 5-year survival rate, not for overall survival rate, right? Our main motto, initially I thought like the village people and the village background people, they don't know the value of the symptoms or the body that gives us some of the notifications. Some signals are always being sent to us, but still we keep ignoring it. So I thought I started my first awareness camps I think I have done more than 20 plus, and total population covered is more than 7,000 population till now. So that I started from my native district, that is Kadapa, Hyderabad to Northeast including Kenya. So this is my spectrum of the coverage about my awareness programs. So unless you are aware, you can't be alert. If you are alert, you can alert your family and your future family also. One more global statistics I will tell you. From now onwards, 2035, there are going to be a 250 million deaths due to cancer. I am sure all these young crowd who is presenting here will all fall into the same age group of more than 35 years by that time. So to start with, what is cancer? It is a basic definition of cancer is unwanted, purposeless growth of the cells that overcome the normal cells. They take the food of the normal cells, they keep growing, which is not useful to our regular body functionality. They keep spreading to the other body, so that they keep taking over their nutrition. So the normal cells will get deprived of it. The end of the life, the patient is going to be completely emaciated and cachexic. So this is about unwanted, purposeless growth of the cells. This simple thing you can compare with a terrorist in the societies. 8 members in the women are going to get a cancer. This is an international statistics. Most of the smokers, I am sure, I think some of you might be doing this. Most of the smokers are bound to get a cancer. Anything like how our forefathers has given a good awareness, early detection of the disease, and they have cured whatever the diseases I mentioned before. So now it is our duty to cure the present disease. So body always sends you some kind of signals. So it is our minimum thing that we should always identify it. Like if you take if you take from the head and neck, any wound or any ulcer in the mouth not healing for more than 2 months, you can make it, mostly it could be a cancerous. And any cough that is persisting for more than 6 weeks of the time, with kind of a sputum, with blood and all those things, is always a suspicious about a cancer. Anything there is a repeated vomitings from the stomach, any unnatural bleeds from the motion or from the urine, all should be considered this thing. If somebody is losing weight, I'll put it in a different way, somebody is losing unintentional weight loss. Maybe somebody might be doing a dieting for some of your body habits. So, but you always should make sure that unintentional weight loss, anything abnormal bleedings, any different lumps and bumps in the body, all these things should be, you always should have a suspicion in your mind that the body is sending you a signal to identify, so that you can go to the next level of the all the workup that you can see. So why awareness is important? I keep saying you, aware people more about it. If you know more about your subject, you can do better in the workspace. So if you know more about your body, if you know more about the diseases in the system, so you can detect it early. Sometimes you can go for early screening and you can identify the disease early, so you can get a treatment well. So another thing is like nobody want to talk about a cancer. I am sure like the present generation don't feel that. You should never afraid of it and never have a social stigma. And if somebody in the family has a cancer, notify it, tell them, so that you will get a good advice from your friends. Unless if you don't speak out, the other family, the neighboring family, who can get more alert, and so they can have the test and so they can do it. The people feel that so telling about a cancer is going to reduce their family reputation, but it is not true. It is only to keep the future generation in a better health. So you always should have a healthy lifestyle. I am sure all are doing a regular exercise and having a good dietary schedule. You know, of course, the environmental factor is not with our hand. It is in the hands of the government, but still to some extent we can minimize it. So these are the commonest cancers. Every body part from head to toe, you can say the oral cavity, lungs, brain, the kidneys, the stomach, liver, spleen, pancreas, every body is more prone for all the malignancies. Among all, I am more emphasizing, because you are all the young, I am more emphasizing on the whatever the bad habits that we have, how it is causing a cancer. So I would like to more emphasize on the smoking and alcohol. So before we know about anything else, we should always know about what are the statistics. If you know the statistics, then we know how to control it, right? So if you can see, all the green area is in so this Asian population, and the dark blue is in European, and that violet color is an American population. You know, they have depicted very small group of this African population which has got a cancer. With this, what we can understand is, the more developed countries has more cancers, but their identification of a cancer is in early stage. That's why their number is less. The poorer country, like all the African, all the nations, so they didn't have a much development in terms of all, like in terms of the chemical usage and all those things. That's why they also has a less cancer incidences. The developing part of the world is Asian subcontinent. So these are the areas where we have a more cancers, less diagnosed in early stage. They are all, most of the people got diagnosed in stage 3 and stage 4. That's why their mortality is very high. All over world incidence is 20 million new cases per annum, and the death rate is almost 50% of it. So this is an aggregation, right? When it comes to Indian, this is about the Indian incidences. 1.4 million new cases, means almost, so majority is from the Indian background only. The death rate is 9 lakhs plus. So even in that, you are almost have those who are presenting in Indian subcontinent are majority on stage 3 and stage 4. That's why you see the mortality rate, the death rate of the cancers is very high in India. The reasons are, I tell you, like I keep on telling you the same thing. The disease presented in late stage will give a poorer outcome, so the death rates are high. So if you identify the same disease in early stage, the outcomes will be phenomenally good, and we can always land up with a European or American background picture, right? Most common cancers are the breast, the uterus and cervix in women. In men, it is the oral cavity, that is the mouth related. If you can notice, in all the women cancers, most of the women cancers are naturally driven because of their regular body changes, and the cell turnover is highest in a women population, starting from the birth to death. When it comes to men, it is all self-inflicted. Most of the all these oral cavities, lung, esophagus, they are related with our habits of so tobacco in any form, chewing, smoking, or any other forms. They all cause the most of the cancers from the mouth to the complete body. In brief about the same, approximately 10 million deaths worldwide. This is 2020. India is around 1.4 million new cases annually. So highest mortality due to the last stage of the diagnosis. The commonest cause are the self-inflicted, that's what I keep saying, tobacco and alcohol. The poor dietary habits, the lack of physical activities due to some various reasons. We keep saying I am busy. I am sure everybody got the same 24 hours. We want to find time, keep walking, avoid the transportation, daily walk for at least 1 hour per day. If you jog, it is weekend and it is good for you. And this obesity and environmental factor, so luckily I am not seeing too much of obesity in your office, but some of the offices where I go, I see a lot of this, so this obesity. You know, the obesity makes you more lazy and it restricts you from going for your regular exercise. So it is a vicious cycle. Unless you break it, so those cycle in some point of time, you won't get a good physical activity. The genetics and family, lot more to discuss about it. Only 10 to 15% of the genetically related cancers. Only 10 to 15. See, most of the time the genetics, everybody has whichever the genes, everybody has a genes that is going to cause a cancer, that is called as proto-oncogenes. And there is one more gene that is called as a tumor suppressor genes, P53 that we call it as. So most of the people will have a good tumor suppressor genes, provided if you have a good lifestyle habits, And this thing, the germline mutations means the diseases that comes from the family is only 10 to 15%. Rest, this 90 to 85% as we are going to get from this environmental background. Among that, more than 30 is our self-inflicted. If there is a possibility of getting a cancer in some family, if they have a poor lifestyle and the environmental factors, they are going to get a cancer in very early stage. When we were about to finish our courses, that time there was a saying that all the screening should be done after 60. Now we brought down to 50, 40, now it is 35. The youngest age I operated is 1.5 year child. Next youngest age is 3 years child. The first baby got a rib cancer from the chest, and the second baby got a liver cancer. And in between that, above 5, 7, 10, I have seen most of the kidney related cancers. And this oldest age I operated is 93 years lady with a colon cancer, right? So in between that, you see so many people. In the similar family, I see nowadays in the last 3-4 years, I keep operating on people less than 30, which is pathetic actually. Less than 30 years. So next, after the genetics and your so the family history, the viral infections. Fortunately, in the urban population, these viral infections are coming down. Most commonly, it is a human papilloma virus. So related mostly commonly, that is a sexually transmitted diseases, and the viral hepatitis, that is a waterborne or it could be a contagious. Hepatitis A, C, D are the water contaminated. B and C are the skin contacted. I think some of all the software industries, they keep doing these tests also. Hepatitis vaccination. I'm sure most of the people will have a different kind of the misunderstanding about a diet. Diet is very simple. Go back to your ancient diet. The diet which are used by our ancestors is a good diet. The diet, clothing always changes between the regions. If you go from the north to south, if I wear a suit and boot, when I come to the south, it looks awkward, right? Because our climate is more suitable for a hot places, more suitable. That is the reason why we need to use a cotton clothing in the southern part of the India. When you go to the Kashmir, you can't wear the similar kind of the dressing. You need to wear a different kind of dressing. So, like the dressing, even the food habits, these ancestors over some kind of centuries, they made a staple diet. And what diet you have to take in what season? Okay, there is a peculiar reason for all these things. We don't agree with our parents, right? If they say don't eat this on these days, we don't keep agreeing it. Very recently, a Japanese scientist who has made a new renovation, fasting of more than 48 hours, or at least 24 hours, is going to kill your cancerous cells in the body. Cancerous cells are weak to start with. They become strong when they start growing. So when they are weak, the body is going to make them autophagy, means the body is going to kill it. So keeping all this in mind, over a period of time, even I used to make fun of my mother and father when they say like, follow these rules and regulations. Now I am introspectively, I am changing myself. Maybe with age you all will change. So this is how, go back to the diet that what your fathers and all the forefathers was taking. The simple example is the probiotic diet. You all know Sadhyanam antam Telugulo, right? So that is coming back with a huge cost now. In some of the centers, they are charging 2,000 per a cup of bowl of a probiotic meal. Only the name is changed, but not the content. So less added sugars. I want to just emphasize only on these top areas. Sugars. Sugar are two varieties, natural and artificial. The one which is available naturally in the form of a fruits, that is fructose, sucrose, glucose. They are good in most of the time. The sugar that has been artificially made are going to have a big impact on these cancer cells. I told you like to start with, these cancer cells are weak. When they get a muzzle, that is what we are providing from outside. Most of the stored food, sorry to say, the burgers, cheeses, I am openly saying burgers, cheeses, they all will travel from the Western countries to India. To simple example, I will tell you, whichever the food that bacteria is not liking, that is not good for you. Right or wrong? If bacteria don't like that food, so that means it is not good for us. To minimize more, I will tell you the burger which has started, the cutlet in the burger will be processed in America. Whenever you read in their content, they say it is a permissible preservatives. If you take one, it could be permissible. If you take two, it won't be permissible anymore, right? So, if the bacteria is not going to eat that food, means it is not going to good even for us. The food which is not going to get spoiled more than 40 hours, or you can say you can minimize even that. The food which is good is around 40 minutes on either side. The freshly cooked food 40 minutes. After 40 minutes, the bacteria will start its function. Okay. So, it is the simplest way I told you is, if the bacteria is not liking, if we are liking it, that means we are inviting a problem. Okay. Carrots and all the vegetables that all been written there. This all you know. So, in Tamil Nadu, so recently they have banned a cotton candy. Right. Even there are some of the new messages are coming up in the WhatsApp. The cakes that we are eating for decades, all are carcinogens. The color which we add in a gobi or in a chicken manchuria or whatever you call, the one which you can't clean it. How can a body can clean it? Right? Even you need to take lot of stress and you need to use lot of the soaps to clean the dirt that is happen to a hand. How can a gut will clean it? So these are the simple statements, like you should always remember, the one which looks good to eyes is not good for a tummy. So make sure that you are all the young, smart, intelligent people, you should know the justification, when to stop, when to continue. So the regular physical activity is going to reduce almost all the cancers, especially with respect to the breast and endometrium. It is a syndrome called as a syndrome X. More fat in women, they are going to get more cancers of the breast and the cervix. It used to be cervical cancer before. Now it is the breast cancer that is prevailing even in India. So these are the cancers associated with drinking alcohol: mouth, throat, esophagus, liver, colon, breast and voice boxes. This is about smoking. You know, the smoking, the cigarettes has a 158 carcinogens. Carcinogens means the chemical that is going to got a cancer attitude. If you take any chemical, if that is going to give you a cancer, that we call it as a carcinogens. The smoking, the cigarette is having a 158 carcinogens. And one more thing, the cigarette is going to cause almost every cancer in the body. You take it my word, from the head, bone, up to bone, from superficial skin to bone. It is going to cause, and the bad part about it is, whatever the mutation that has happened with a smoking in our body, that is going to get transmittable to the next generation. Understood now? Whatever the changes that has happened. So all the changes that is happening in any gene level is, one is it comes from the family, the second one it comes from our habits. Whatever the mutation is going to happen is going to get transferable to the next generation. So you should always make sure that our forefathers has preserved a good body, good mind, which we are not going to give it to our next generation. See, my focus is only on future generation. The mutations అనేది ఫ్యామిలీలో ఎప్పుడెప్పుడైతే రన్ అవుతుంటుందో, ఇప్పుడు మనకుండే ఈ బాడీ నేచర్, బాడీ స్ట్రక్చర్, మన పూర్వం అందరూ కూడా ఇచ్చిన ఒక గుడ్ ఫిజికల్ స్ట్రక్చర్, రైట్? ఒక హెల్త్, ఇప్పుడు మన ఫాదర్స్ అందరూ కూడా 70, 80, 90 years బతికినారు. బట్ దే ఆర్ నెవర్ డిపెండెంట్ ఆన్ ఎనీబడి. బట్ ద ప్రజెంట్ డే ఏమవుతుంటే, మనం చేసే హ్యాబిట్స్ వల్ల, ఎన్విరాన్మెంటల్ వల్ల, అట్లీస్ట్ మనం చేయగలిగే స్టాప్ చేసే ప్రొసీజర్ స్టాప్ చేస్తే, సో నెక్స్ట్ జనరేషన్కి ఒక బ్యూటిఫుల్ లైఫ్ ఇవ్వచ్చు, రైట్? ఇప్పుడు మనం ఈరోజు బతికేది, సంపాదించేది అంతా ఫ్యూచర్ జనరేషన్ కోసమని నేను బిలీవ్ చేస్తాను. మీరు బిలీవ్ చేస్తారు కదా, అది మీ పేరెంట్స్ ఎట్లనో మీరు ఎట్లే ఉంటారు. మేబీ ఇప్పుడు మీరు అగ్రీ చేయకపోవచ్చు, బట్ ఫ్యూచర్లీ యూ ఆల్ షుడ్ అగ్రీ దట్ వాట్ ఎవర్ ద జీన్ దట్ ఆర్ వాట్ ఎవర్ యు ఆర్ ఈజ్ ఫ్రమ్, వీ డోంట్ నో ఫ్రమ్ వెన్ ఇట్ వాస్ స్టార్టెడ్, రైట్? దే ఆల్ ప్రిజర్వ్డ్ ఇట్ and we are screwing it up. So you don't have any right to screw it up anymore. make sure that you do a good job and give a good genes to the next generation. So when you take about alcohol and drinking, I'll tell you, when you have a chances of getting in, by taking an alcohol, if it is a 5%, and when you smoke, you will get an chances of getting a cancer is 5%. When you combine these two, I notice most of the people drink, smoke. When you combine these two, it can't be 5 plus 5, 10. It is going to be multiplication effect. It is going to be a 25% chances of a cancers. So I repeat it, it can't be 5 plus 5, 10. It is a multiplication effect that is going to be 25% risk of the cancers when you combine these two. And some smart people will keep saying that I only have only 5% because I only drink and I don't smoke. So these are the, like, if you have more smoking, you get more of the followers, and they give the message at the end as is the cancer. So same thing, like this is all the same in different stylish posters, but the discussion is same. So the weight management, most of the present day statistics are more gaining weight in an urban population. Surprisingly, when I go to awareness camps, even the villages, the obesity is increasing now. No kid is now so less than normal. When we were studying in medical college, that time when we go for a camps in the tribal area, we used to see the kiloses and the vitamin deficiencies. Those times they used to taught us about kwashiorkor and this marasmus, means a thin baby or with a unhealthy obese babies. Two posters you might be seeing it. So that is all because of the nutritional deficiencies. Now this is a overnutrition. See, you need to balance it. Too much of money, too less of money is not good. Too much of weight, too much of underweight is not good. You should maintain optimum BMI, that is a basal metabolic index, that is. So all the obesity is going to cause more of the diabetic related, cardiac related, joint related and cancer related also, right? Most of the women who we call them as syndrome X, they will have PCOD problems nowadays, right? Infertility related, breast cancers, endometrial, colon cancers, all these things are going to happen if you are more than your targeted weight. Stress, so this is about the software people, I keep saying you. Stress is what you take it, what you feel it on yourself. There is no word called as a stress. It has been marketized more than what it's supposed to be. Okay. If you ask a first class going student, if you ask, I am stressed up, mom. He feels stressed about his class homework. And like that, stress is no definition about it. It has been over marketed to avoid your skills or to avoid your working nature. Stress is something is a misnomer according to me, because when somebody, if you can see the Modi, if he can work for almost 20 hours in a day and he is never stressed up, why we are feeling stressed up? Our mother, she wakes up at 5 o'clock, she sleeps at 11 in the night. She never says I am stressed up. So that means if you say something stressed up means you are underdoing your capability. You are supposed to do what you are. Actually, your the stress levels is always people blaming is about to avoid the work or to say that you don't know this work. So bluntly say I don't know. Don't know is a good word than saying stress. So just a few words about, because this has been given in literature, I am just more emphasizing on it. So the weekend parties, most of the time it goes for stress relief, right? No, it is a cancer inviting programs. Okay. You feel it is a stress relief. If you are happy with after drinking or doing it, I am sure the next day morning they get a hangover. So whichever is that activity that is not going to give you a happiness, so it is not a stress. Stress relief is the best is sleeping. Sleep for 10 hours, 11 hours. Give the body complete rest. Sleep has a major role nowadays. Okay, I'll tell you on the next slide. So adequate sleep, you know, every body cell has its functionality. Like how you work here, you wake up in the morning, you do some work, some activity, home work in your kitchen or something. You come to office, you go back, then you sleep. Like that, every cell needs it to repair itself. If you give a rest, like even if you run your bike for some 1,000 kilometers without break, it is going to get breakdown. Every body or every cell needs a rest for some time. Like the body has a multiple layers of the cells, organs, tissues and all those things. Especially the cancer cells which has been produced by some reason, somatic or germline or some other reason, they all been eliminated by our body immune system. Body immune systems contains a WBC count and the other cells called as the natural killer cells, interleukins, lymphocytes, and there is a defense forces that are there within us. Like how we have a forces in our this society, like the normal police, SPG, military and all those things. If there is some kind of hierarchical system in our security system, even body has a similar immune system. It has from the smallest to the worst. It keeps circulating in the body, it keeps identifying which cell is an abnormal and it is going to kill it. So our body has the immune responses for any abnormal cells or any other cells. So if you have a less sleep, those cells are not going to recognize these abnormal cells. Then they keep avoiding the immune system. The tumor cells, they keep avoiding the immune system by making a mask on it. So they seems to be normal from outside, unless if that natural killer cells is smart enough to identify it. Most of the present day researchers, the Johnson and all the major companies, they are doing on how to improve the immune system. Rather than providing a chemicals to kill the cancer cells, now we are going to promote the most of the monoclonal antibodies, and there are a lot of interleukin cells related studies going on this. So once they are trying to boost up the immune system, whatever the immune system if you have, if you try to build up on your own, then you don't require anything from outside. So the prevention always, hydration, good water intake. So the more water intake, I can't say more, I can say an adequate water intake, always going to flush out the impurities. The simple example, that those who are going to have a regular bowel habits, as per Indian standards, because the regular bowel habits has a different definitions in the different countries. In one of the Italian system, they say 1 or 2 bowel movements per week is fine. But in India, the standard rule is daily once or twice. That is what we keep saying. Because whatever the food, whatever the chemical related food we take, or whatever the cancer related food coated system that we take, it is going to have a contact with the bowel for a longer hours. The more longer it have a contact with our bowel movements, the intestinal mucosa, the cancer is going to have a more impact on that area. So if you flush it out fast, so there is a less contact between the chemical carcinogens and your body. So there is a less possibilities of having a cancer. So like if you take good water intake, good fiber diet, fiber is going to clear your bowel, and the water intake is going to clear your urinary system. So most of the cancer related, or we can say the chemical cancer related system will be flushed out if you have a good hydration and good fiber diet, right? Have a good urine and have a good motion. So at the end, this is what I keep saying. This environmental awareness, as a part of it, other than what we earn, we have our responsibility over our environment too. At least if you can't made it well, at least don't spoil it, right? And even the bottles that which we use has a microplastics, unfortunately still we are using it. I always carry my bottle, a steel bottle or copper bottle in my car. I want to get it then here also, but I feel like a little shy to get that bottle. That's more than that. These lot of researches are going on these microplastics. Microplastics, even when they cut the fish, even the fish muzzle has a microplastic. Recently, when they have identified the human body also, Human body also has a microplastic. All the polymers, whatever you use in this, so the bottle. So the simple logic I told you, whichever is not going to spoil for more than its stipulated time, that is not a good to for us. Now, so this is more important. I can't say I am too old to get a medical checkups. Have a regular health checkups. I told you we used to say 60 is the basic investigation modality. Now brought to 50, 40, now 35. I don't know, in future it may come even to 25 also, right? So have a regular health checkups, very basic simple checkups which is going to cost a very meager price. So then all the diseases that if you can identify in early stage, so it is good for us. Early stage disease, you are going to have a simple treatment. If you find a lump, you can excise it, and you don't need any other treatment after it. If you find the same lump at a later stage, you have to undergo to the surgery, chemotherapy, radiotherapy, immunotherapy, monoclonal antibodies. So you are going to keep adding up of the new drugs, and that is going to empty all the financial resources, right? And the monitor these existing conditions. If you have a regular checkup like sugar, BP, and all those things can be well maintained, and it can prevent even the futuristic problems also. If there is a stage called as a pre-carcinogen, the before cancer, to get any cancer to form, it takes minimum 5 to 10 years from the time of it started to from the time it has become a complete cancer. It is going to be 5 to 10 years. We have a good ample number of years to identify it in a very early stage. So that all will save you the money, you will get a peace of mind at the end, which is more important. The quality of life is very much important. And there is a misnomer that only female has a breast, they only get a breast cancers, but it is not true. Men, women, both are going to get a breast cancers. More in women, less in men, but all will get a cancers in that. My first operated after I came from the armed forces is a male breast cancer. First I operated. Very simple, very easy, nothing to get shy. I will just show you to all. All should do it, and you should always tell your mothers, sisters, and your friends, neighbors, everybody how to do a self-examination of the breast. Very simple, easy to identify. The importance why I keep saying is about self-examination. Your breast is well known to you. Your body is well known to you. So always start examining it. All people who are before the menstruation, like before the menopause, those who are menstruating, 5 to 10 days after they finish their last cycle, right? For others, like during pregnancy or post-menopausal people, they all will have a every month first date, right? So start checking it, and it should be checked in the two positions, by lying down on the bed and by standing in front of the mirror. You need to check it from the both hands by the side. Always see for the both breast, see the nipple level, whether it is same or not. Then you need to raise your hands, see for both your armpit. So this is only to see about any change in the breast. It could be any forms of a bulge, any form of a pudgy, the skin changes over it, dimpling, any other swelling in the both armpit has to be noticed. And always after that, you need to check with your 4 fingers, not with the tip, not with the bottom, in between that. So this is too sensitive, this is too not sensitive, so you need to say the middle one. Always start from the 12 o'clock. If you take this as a wall clock, start from 12 o'clock, do it in a circular fashion. Okay? If you keep doing it, you will always find a nodularity. That is normal for the younger breast. And when you start checking it every monthly, you are going to find out which is normal, which is abnormal, right? So then same thing at the end, you need to press it from the all directions and come to the nipple area, and you need to press that. If you find anything abnormal blood or green color fluid, that is going to get alarm you, but most of the green color fluids are not the disease, they are all the normal. Okay? But if you find any one of these things, you need to consult your local physician, get checked and get a simple scans, and you can rule it out. Understood now? So I am going to repeat it. So check it in the 2 positions, standing and the lying down position, arms raised, arms by the side, and when you start checking, you need to press it against your waist so that the muscle underlining, we call it as a pectoralis muscle or called as the chest muscle. So that is going to get contracted. Whatever the swelling is there, that is going to become more prominent if you do that. So these are the positions: by the side, by raising hands, by pressing against the hip. So check the contour, any abnormal skin, any lumps and bumps in the breast, both in the axilla, and start checking from the 12 o'clock to 12 o'clock, and from the bottom to the towards the center of the nipple, and press the nipple. So this is the simple examination. Do it every month after you finish your cycle, 7 to 10 days later. And for other people, so they can check it standardly first day of any month, right? So with this, the pap smear also you need to get every year. Pap smear is to rule out the cervical malignancies. This vaccination, those who are between 10 to 14 years, they all will have a 2 doses of the quadrivalent. So they have mentioned a single valent, but ideally we are going to give a quadrivalent. It is a 4 vaccination, 4 HPV virus. So HPV 16, 18, 31 and 33. These are the 4 quadrivalent vaccination that we are going to give it. 0-1 is the dose before 14 years. After 14 years, it is a 0-1-6 or 0-2-6, right? So this is the standard dosing. Ideally, it should be given before first sexual contact. That's what we say. See, the hepatitis virus is a virus which is, there are hepatitis A, B, C, D, E. B and C are mostly dangerous. They are going to have a more problems with that. And when somebody is infected with B and C and they also get alcohol related liver cirrhosis, in combination they are going to get a more harm. So these viruses are going to give you the cancers related with the liver. So that is the reason, to prevent it, we are going to, all these vaccinations are very simple. We are going to give a part of those virus capsules. So the body is going to generate antibodies to it. That's how we are improving the immune system. Once the immune system is good, so it is going to give a good outcomes, and it is going to prevent the cancer. It is going to prevent it, right? In the breast cancers, those who got so less than 35 years of a woman, or 2 members in the same family, or any single male breast cancers, all these things they have to go for a regular screening before 35. So ideally we used to tell about after 40, now it is before 35. You understood, na? Single family member, so less than 30-35 years, or 2 family members in the family, or a male breast cancers in the family. Okay, these are all will have a more prone for the next generation. And regarding the breastfeeding, I didn't mention it here, but breastfeeding is going to prevent all the cancers, because breastfeeding of more than 5 years is going to reduce your cancer risk by 50%. That's a huge thing. So genetic counseling, these are all available in the now within our society. Those who get a series of cancers, so they can go to a genetic counselor. They always give you your pedigree. They keep noticing all the family members in the family, both from the maternal, paternal, 2-3 generations. They keep assessing you that, you know that who is she? Angelina Jolie. She got operated for her breast. Both breast has been knocked out, and she got a risk reduction surgeries we call, and it is 99.9% risk reduction. Her maternal aunt got a cancer, and she got a genetic testing about her cancer. She got a percentage of around 60-62% of the more prone for cancer. So she got the surgery done early. So this is about a genetic counseling. Cancer is always fatal is not a truth, and early detection and so getting a good treatment and prevention is one of the survival rate is going to improve. Only smokers will get a lung cancer is also myth. Smokers get a worse lung cancer than with a non-smokers. So to simplify that, the smokers will get a squamous cell, or we call it non-small cell lung cancers. For non-smokers, it is going to be an adeno cancer, which is relatively thankful than a smoker's cancer. Have a healthy lifestyle habits, regular checkups, and our most of the work don't finish by treating us. The awareness whatever I told you, get your family members to the neighboring hospitals, get a basic test which is going to cost around 5,000 maybe now with the, as per the present scenario. If any one of us will be identified very early disease, I am sure you got a good family.